here, there are 7 vitamins all kidney disease patients must know all about. I mean, as long as they don't want to end up tied to a machine. And I'm not joking. There are cases documented in literature of CKD patients that were near stage 5 and that were able to improve just by supplementing the right vitamins. Having low levels of one or more of the 7 vitamins I will show you today is linked to proteinuria, anemia, bone problems, hyperphosphatemia, more risk of passing away, and a faster decline in kidney function. So let's take a look at what these 7 vitamins are, and don't miss our number 1 in particular because, well, that's the vitamin that CKD stage 4 and 5 patients are using to say no to end-stage kidney disease. But before that, let's start with number 7, vitamin K2. While I don't personally supplement every single vitamin like so many people do, I do supplement this one vitamin every single morning. I take 200 micrograms of menaquinone MK7 to be exact, and with some fats. And in my opinion, you should do the same. Why, you may ask? Well, first of all, because this is a vitamin that's crucial to supplement when taking the kidney vitamin or vitamin D. It will be very unwise to supplement vitamin D without this vitamin, and it will be even worse not to supplement vitamin D. More about this in a moment, but there is a lot more about vitamin K2 than just supporting vitamin D. You see, today, cardiovascular diseases that are also caused by arterial calcification are the number 1 cause of death in the world. And while vitamin D is needed by the body to utilize the calcium in your diet, it doesn't tell the body where to put this calcium, alright? Without vitamin K2, calcium may as well end up in your arteries, increasing your risk for heart disease and even kidney damage. Enter vitamin K2. Vitamin K2 helps make sure the calcium ends up where it belongs, absorbed by your bones. And this is going to come with several visible benefits. People have reported visible improvements in dental health when taking vitamin K2. As in, those with small cavities have seen them disappear. And since this vitamin reduces the inflammation in the body, it can even help with arthritis and bone pain. I mean, this is a vitamin you will actually feel. Question: how to supplement vitamin K2? Now, there are 2 types of vitamin K2 you could supplement, MK7 and MK4. And you can also get a little bit of this vitamin from foods such as natto, for example. But what I usually recommend is to just buy vitamin K2 in the MK7 form, which is the cheaper and easier to find, and just supplement 100 to 200 micrograms per day in the morning with fats. Again, I do this personally and it works. And guys, if you think this info is useful, don't forget to like this video and to share it with a friend if you want to. Number 6. Up next, as I was saying, the main reason why vitamin K2 can help you fight kidney disease is the kidney vitamin, vitamin D. When it comes to the kidney vitamin, vitamin D, there are a couple of facts that could literally be vital for any kidney disease patient. First, vitamin D is the most common vitamin deficiency in people with CKD, alright? As we can see, up to 84.7% of CKD patients have too low levels of this vitamin today. This is an extremely serious problem because it directly makes kidney disease progress faster. And I'll be very clear on this. In all the stages of CKD, the lower the vitamin D levels are, the faster the decline of kidney function. There is a long list of reasons why having low levels of vitamin D will damage your kidneys as well as many other organs. But what I want you to know about this vitamin is that you need not just to supplement it, but to make sure your levels are in the right range. Because when you are able to bring your vitamin D levels up to the correct value, a miracle is going to happen. You are going to benefit from a huge improvement in your proteinuria level, which is probably the most important marker for kidney function decline. I mean, lowering this level means delaying end-stage kidney failure, and you need vitamin D for that. Now, here's the second crucial fact. The kidney is the organ in the body where vitamin D gets activated, alright? What this means is that while for some patients taking 2000 IU vitamin D3 a day or 50 micrograms in the morning with fats may be enough, those in the advanced stages are going to need a prescription form of this vitamin. These are medications called vitamin D analogs. These include calcitriol, paracalcitrol, calcifediol, and more. The correct type of vitamin D analog and dose depends on your serum levels and on your thyroid hormone levels. Blood tests are required for your doctor to make the right prescription if you need a vitamin D analog. And don't forget to supplement magnesium with vitamin D. This vitamin depletes your magnesium and you don't want that. Up next, a secret vitamin that's extremely useful for those who want to lower their glucose levels. This nutrient was proven able to cut your glucose levels by a whopping 31.5 milligrams per DL in just 3 months. So, we have seen two vitamins that are essential for almost every single kidney disease patient, alright? Two things you absolutely need. But what I'm going to show you next is different. This is a vitamin that can make a huge difference for people with diabetes, and it's something not everyone knows about because, well, it's not considered a vitamin anymore. I'm talking about vitamin B8, better known as inositol. Now guys, if your goal is to get diabetes into remission, you want to look into a supplement of this nutrient. Inositol has several important functions in the body, including controlling sugar and insulin levels, fat deposition, and hypertension. This works because it has a structure similar to that of sugar, alright? So it will occupy the receptors for sugar, but inositol is not caloric. In the end, adding more of this vitamin actually improves blood sugar control, which is basically saying that it fights diabetes. But how effective is it, you may ask? Research shows that supplementing inositol in people with type 2 diabetes can lower glucose levels by a huge amount, 31.5 milligrams per DL in just 3 months. In this study, HbA1c of the participants went from 8.6% down to 7.7%. Now guys, this is very significant, and it can make a big difference for someone with diabetes, especially on the long term. In fact, one of the ways in which diabetic patients achieve an improvement while taking inositol was by losing weight. Inositol can in fact reduce food cravings and appetite, creating improvements in diabetes markers that can be sustained long term. Now, very important, while inositol is not an essential nutrient because the body can make a little bit of it, the organ in the body that actually produces this vitamin is the kidney. What this means is that CKD patients, those in the advanced stages in particular, may be deficient in this nutrient. And since inositol also has other benefits, it protects the kidneys from metabolic syndrome and hypertension. It may be well worth looking into supplementing it. You can get some inositol from foods as well, including some fruits, beans, grains, and nuts. Stone ground whole grain bread in particular contains up to 300 milligrams of inositol in just one slice of bread, and that's a lot. But not everyone can eat bread, and a better option may be cantaloupe, a very healthy fruit even for people with diabetes. And if you are really interested in the insulin mimetic properties of inositol, it will be better to also consider a supplement. In short, inositol can be used to greatly improve insulin sensitivity in people with type 2 diabetes. It can lower sugar levels by 31.5 milligrams per dl. And to achieve this, myo-inositol 550 milligrams and D-chiro-inositol 13.8 milligrams with folic acid 400 micrograms was supplemented twice a day for 3 months. This is a combination that can be bought from many supplement stores, Amazon included. Let's take a look now at the vitamin that's, on the other hand, completely essential to supplement for everyone but especially diabetes patients. In fact, relying on the diet alone may trigger a dangerous deficiency in vitamin B12. Okay, here's another vitamin that you must know all about if you have kidney disease, especially if you are following a plant-based diet, because you see, most plant-based foods are chock full of vitamins and phytochemicals and antioxidants and nutrients in general. There is only one thing that's missing, vitamin B12. And as I was saying, diabetes patients must be even more careful when it comes to vitamin B12. In fact, metformin is known to cause vitamin B12 depletion. But what happens if you don't supplement this vitamin, you may ask? Well, your kidneys are going to suffer and you as well. You see, in order to make red blood cells, the body needs several things including B vitamins such as B6, B9, and B12. Now, very important, a deficiency in any of these, even alone, can trigger anemia. By the way, I won't go in depth about anemia today, but if you have any of the symptoms including fatigue and always feeling cold, maybe get informed about it. And I've made a full video about anemia. It's up here and also down in the description. Because anemia is a serious risk. It is one of the most dangerous and most common complications of CKD, and it can cause kidney damage. But while you can get some B6 and B9 from foods, there is no way to get enough vitamin B12 in a plant-based diet. Now, if you start taking vitamin B12, you will immediately notice it even faster than vitamin K2. For someone with low levels of this vitamin, taking it will feel like drinking a cup of coffee, but better. Now guys, the way to supplement this B vitamin is with the other B vitamins. There is one vitamin in the B group in particular that's crucial for your kidney health even more than vitamin B12. I'm talking about number 3, folic acid or vitamin B9. Okay, but how is it possible that folic acid is even more important to supplement for kidney health than a vitamin that you can't get from foods? Well, because this vitamin directly slows down CKD progression. A recent study was able to prove that patients who took 0.8 milligrams per day of this vitamin had a significantly slower progression of kidney disease. As we can see here, we are talking about a 44% slower decline in kidney function. Now, this was a big study. It was conducted on more than 15,000 CKD patients and lasted for more than 4 years. This vitamin resulted in a significant reduction in the risks for a significant decline in kidney function during the test period, and also a significant reduction for the risk of death and a very significant reduction for the risk of dialysis, just thanks to one vitamin. But keep in mind that 0.8 milligrams per day is twice the RDA for this vitamin, alright? This is why most multivitamins made for kidney disease patients have exactly 0.8 milligrams of folic acid in them, as well as all the vitamins of the B group. So let's talk about the vitamins of the B group. As I was saying, all the vitamins of the B group must be supplemented together. Vitamin B6 is, in fact, frequently too low in people with kidney problems, and it's crucial for the nervous system, immune system, and red blood cells production. Vitamin B2 or riboflavin boosts the immune system and fights headaches. Vitamin B3 or niacin helps with cholesterol, phosphorus, and more. B5 fights stress. B7 lowers blood sugar in diabetes. And I've kept one of the best for last, vitamin B1. This one is crucial for energy production, and it's also needed by the nervous system to work properly. And according to a study, taking high dose thiamine can protect the kidneys of people with diabetes from damage. Diabetic patients in the early stages of kidney disease treated with high dose or 300 milligrams of thiamine for just 3 months saw a return to normal urinary albumin excretion. This means that their kidney disease actually regressed and their creatinine was immediately lower. So now you may ask, how can we find all these vitamins in the right dose and form? Well, luckily for us, many commercial brands sell B complex in doses that are perfectly suitable for people with kidney problems, which is great. It means you can just buy a regular B vitamin supplement from Amazon, for example, and take it every morning. But how can you tell if a brand is right for you? Well, just look at the doses for the vitamins it contains. The closer they are to the 100% of the RDA, the better. And when it comes to B vitamins, you can get up to the 200% or more of the RDA for B vitamins without problems. Here are some brands that have what you need. You may see that the doses here are very close to the RDA or a bit more. It's important to notice that vitamins of the B group are not dangerous when supplemented in daily doses around the 100% to 200% of the RDA for the general population. Do not supplement B vitamins in very high doses though, especially vitamin B6. If you see a supplement that has more than 600% of the RDA for this vitamin, don't take it. Okay guys, time for our number 1 now. As I was saying, there are CKD stage 4 patients that are using this vitamin to say no to end-stage kidney disease. This was documented in a recent case report about a stage 4 CKD patient who was actually starting to prepare for renal replacement therapy. Everything changed when he started to supplement one vitamin. This vitamin is niacin or vitamin B3. Now, niacin is a powerful vitamin that's extremely beneficial for your kidneys. But what really made the difference in this study was the dosage that was used. You see, the reason why it was possible for this patient to go back to normal kidney function thanks to niacin is because this vitamin is a powerful phosphorus chelator. Phosphorus is one of the most dangerous toxins for CKD patients, and having too much of it damages the kidneys and the heart faster than anything else. And higher intake of niacin is linked to decreased phosphorus levels in kidney disease. But as I was saying, this patient needed to take a large dose of niacin every day, a lot more than what you will get from a renal multivitamin. And this dosage may come with some side effects you should absolutely know about, and my suggestion here is to get informed before raising your dosage for this vitamin. And I've made a video just about this case report. It's up here and also down in the description. And this is all for today. Thank you for watching. God bless you all.